Thank you for joining us.
That's my pleasure.
It's a pleasure to host the founder of Critical Care Reviews here in Krakow. My first question would be, how do you stay up to date in critical care?
It's a challenge. There are a lot of different ways of staying up to date. Obviously at Critical Care Reviews, that's what we do. We spend our time trying to keep people up to date. So an easy answer is to use Critical Care Reviews, subscribe to the newsletter, and all the latest important publications and interesting publications of the week are emailed to you on a Sunday night or Monday morning, depending on how long it takes the email list to spool through. That's the easy way of doing it. Harder way of doing it is do it yourself. It takes a lot of work, and there's different ways of doing that. All the content's pretty much in journals, so that involves then either subscribing to journals or having email table of contents sent to you, or signing up for alerts, or else using databases like PubMed or Google Scholar, and again setting up alerts, frequent alerts on different topics, and having all of those come to you. But that's a workload. There's a lot of time and effort goes into managing something like that, and if you do use it through email, it can clog up your email unless you have a specific email address for it. Alternative ways are to use RSS feeds. Not every site uses them. Sign up to the RSS feed for a specific podcast or journal or society, and bring it into your RSS catcher aggregator, and everything will be there. But of course, the feeds just keep coming, and they keep coming, and they keep coming. So if you don't keep up to date with it, if you don't maintain it, then before you realize it, if you go away on holidays, you'll have a lot of material in there. So there are challenges to staying up to date. It's easier to use one of the methods that are already out there and running than trying to do it yourself, unless you have a specific interest in a certain area, in which case you probably want your own searches set up.
Are there any trials that had been published recently that immediately changed your clinical practice?
Oh, that's a great question. All the trials that come out get incorporated into the previous body of knowledge and add to the previous body of knowledge. Two of the big trials recently have been Classic and Clover's, looking at fluid therapy in sepsis and in septic shock, and between the two of them, they're not quite the same trial. They look at slightly different aspects of a larger picture, which is minimizing intravenous fluid resuscitation and therapy. And they've both shown that it seems to be safe to run patients on a drier side. So that's been very encouraging for those of us that do tend to run patients on the drier side. That's affirming treatment, whereas before we thought that was the right thing to do. We've certainly moved well away from the rivers type fluid therapy of 15 years ago. So there would be a couple of trials that have been very useful to affirm practice. That has actually changed what I'm currently doing. That is a good question. Off the top of my head, I'm not sure I can get one. I could pick a single trial that has specifically changed my practice. I think a lot of them, thankfully, have affirmed my practice. There aren't that many trials that demonstrate benefit in critical care. A lot of the recent trials have identified that less is more, that general concept that a lot of what we do doesn't actually make a huge difference, doesn't necessarily improve outcomes, and therefore we can probably do less. So a lot of the trials would align with that, in that we can do a little bit less. Maybe the pilot trial, it's not a direct outcome, but we're maybe moving away from allowing people to be relatively more hypoxic. You know, saturations in the high 80s, maybe we'll move back towards the mid 90s. But you know, it's great to have all these trials in critical care. Critical care is a brilliant specialty because there's such a body of evidence produced on a regular basis to guide what we do.
Okay. What is the lineup for this year's Critical Care Reviews conference?
It's really exciting. At the moment, we have 6 major trial results, and we may be able to squeeze in a 7th. So we have the UK Reboa trial, which is the first randomized controlled trial investigating the efficacy of the Reboa device which is an aortic occlusion balloon in patients with severe traumatic hemorrhage. So that'll be really interesting. We've got another couple of trauma trials. Patch trauma, which is an Australian, New Zealand and German trial, which is investigating tranexamic acid in patients, again, with traumatic hemorrhage. Crash 2 trial changed practice worldwide, but there were some questions around aspects of it. It was largely done in lower income countries with less well-resourced healthcare systems. Would tranexamic acid make as big a difference in a better resourced country that has, say, interventional radiology, the ability to embolize, has a better developed pre-hospital service, perhaps pre-hospital blood products? So there were some questions about Crash 2 that Patch will hopefully answer. We have the Cryostat 2 trial. Cream Brohy from London will present that. That's looking at cryoprecipitate, again in traumatic hemorrhage, so that'll be fantastic. We will have Pierre Bozat from France come and review the ProQuag trial, which was presented in Brussels a few weeks ago. And that's looking at prothrombin complex concentrates. That's a trial that we'll review. So that's 3 of our major trial results. The other three trial results that we have at the moment are the device trial, which was mentioned earlier on today, and that's a 2,000 patient American trial from the Pragmatic Critical Care Group in the Midwest. In fact, I think they're pan-American. That's comparing video laryngoscopy with direct laryngoscopy in 2,000 patients in the ICU and ED, so that'll be fascinating. We have the TAME trial, which is a big international trial. It's been headed by Glenn Eastwood from Melbourne. That investigates the use of mild therapeutic hypercapnia post-cardiac arrest. So will this allow slightly more blood flow to the brain in the absence of catecholamines to drive that? And will that be associated with better outcomes? So absolutely fascinating trial. The 6th trial on our program is OxyPICU, which is a big UK trial looking at oxygenation targets in pediatric patients. So they're comparing SATs of 88 to 92 with greater than 94 in critically and mechanically ventilated children. So there's been a number of trials looking at oxygenation targets in adults, the most recent of which was PILOT, and we'll also have PILOT as one of the trials that we'll review at the meeting. But OxyPICU is now replicating this in children. So there are 6 trials. The trials that we'll be reviewing, as mentioned, PILOT, OxyPICU, ProQuag. We also have TEAM, which is a trial looking at early mobilization in the critically ill. Fascinating trial, suggested harm with that practice with very early mobilization. So it'll be great to have Carol Hodgson from, again, Melbourne come and present that and give us the opportunity to explore that in depth to see just exactly how we interpret that trial. We have AID-ICU, which is a brilliant Danish trial looking at haloperidol in delirium in intensive care patients. A fascinating trial to discuss. The primary outcome was suggestive but not confirmative of benefit. There was a mortality benefit, but that's part of a composite primary outcome. So again, how exactly we interpret that trial will be very, very interesting. I think that's... Oh, Clovers. How could I leave out Clovers? One of the most anticipated, highly anticipated trials of the past decade. So Ivor Douglas is going to join us from Colorado and present Clovers. Again, early vasopressors versus early fluid in septic shock. So it'll be great to have the opportunity to discuss that, especially considering that we had Classic last year and we have a lot of fluid researchers at the meeting. So there'll be a lot of expertise there to discuss those. Okay, thank you. See you in Belfast. Absolutely. Please join us. And if you can't join us, watch the live stream, June 14th to 16th. Thank you.